Good afternoon. My today's topic is Malavshtambh or Malavibandha and its Ayurvedic treatment. If you will just look at the Bruhatrayi, that means Charak Samhita, Sushruta Samhita, and Ashtang Sangrah and Hriday, about the abnormalities related to stools, Purish. There are around 450 entries in Lakshan Kosh published by Tilak Maharashtra Vidyapit, Pune. And in that, we find about Malavibandha, that means we can roughly translate as constipation. Around 40 important references are available about that. Now, if you will look at these references, actually, if you will go by the actual texts, then these references are very important clinically also, because we roughly use the word constipation, but the text they use specific words like Purishasya Gadhatvam, and then it indicates Vata Vriddhi or Raktarsha. If it is Purishasya Alpa Pravritti, then it is indicative of Vataja Arsha. If it is Mala Vibandha, then it is indicative of Ajirana, Pravahika, etc. If it is Purisha Sangha, then there are a lot of conditions associated with that, including Udavarta, Vataja Gulma, Vegavarod of Adovat and Purish, Adman, Samadosh, etc. So by using specific word, we are able to reach a specific diagnosis, and there will be specific treatment then. Though, although a person who is making in general his practice, he initially may find it difficult, but with little practice, he can master even these things and reach to a specific diagnosis, and therefore the treatment will be very specific and therefore highly effective. For example, many patients, they complain that they get the sensation of defecation, that means mala vega, but when they actually try to pass the stools, then they are not getting the mala vega. So that means this condition is related to gulma as per the text. Therefore, these things are very important to note. Then we can reach to specific diagnosis. So which are the commonest diseases which are linked with constipation according to Ayurveda? There are Ajirana, Vata Vriddhi, Gulma, Grahani, Udavarta, Prameha even is mentioned, and Vataja Pandu is associated with Malavibandha, Purish Vegavarod, and Purishavrit Vat. And each one of them is having specific presentation. Like Purishavrit Vat, in that it is said that Chirat Pidita Mannena Dukkham Shushkam Shakrut Sujit, that after eating the food and with great difficulty, hard stools the person passes, like that. This is very important because in many patients, ajirana or indigestion is the most important cause, and that's why the stools are not formed properly, and that's why they are not evacuated properly. That's why this description is very important. Also, we can note Vataja Pandu. Unless we treat the underlying condition, unless we treat Vataja Pandu, the relief which the person will get in constipation will be temporary. If we treat Vataja Pandu, then only he will get cured as such. Or Prameha. In Prameha also, hard stools the person may have, or depending upon the type of Prameha, but Vibandha he can have. And then when Prameha is treated, then specifically the person will be cured from his disease. So in general, when we think of constipation from Ayurvedic perspective, then first of all, we will have to understand that there are abnormalities related to Utpatti of Purish, and then there are abnormality related to Pravartan of Purish. It means formation of stools and then evacuation of stools. So like that, in two groups, we can understand the abnormalities. And then the abnormalities related to formation of stools, in that the digestion, and from that the Kitta which is formed, that needs to be understood, because if that is not properly formed, then the stools will not be properly formed, and then there will be Vibandha. then it is told that undukastham vibhajate malam maladhara kala. So at unduk, it is told that the kittansh is divided into ghana and drava part, and from that stools are formed. Now in this process, various factors are involved, like in Ganadrava Mala Pruthakran, Saman Vayu is mainly involved along with Agni. And in Pachan, there are a lot of other factors involved, like Prana and Saman Vayu, Pachak Pitta is involved, and Bodhak Kaf and Bodhak Kaf is involved in that. So these factors, so we will have to take into consideration these factors, whether which of these factors is not functioning properly, and that's why the person is having Vibandha. Like that, we will have to think. Remember that majority patients who come to us, they have constipation because they are not having proper digestion, and because the digestion is not proper, the kittansh which is formed, it is sama, it is containing ama, and that's why the purish which is formed, it is also sama, and this ama is having a tendency to stick inside because ama is having pichil guna, so it sticks inside, and therefore the person is not able to defecate properly, therefore it is not going out properly. If only the person takes purgatives, or if the person makes force, then temporarily some relief may be obtained. But what will happen that due to this process, Vat Prakop may take place or Raksha may be produced, and therefore sometimes this Pichil Guna of Am may get converted into Styan Guna, and therefore it will become more and more difficult to treat that constipation later on. Therefore, we have to understand that majority of the patients they take food late in the night and go to bed after that, or they are not given proper time for digestion, and after, because the digestion was not proper, that's why digestion is not completed by the next morning, that's why the stools are not well formed, and because there is armor, there is stickiness, and that's why the stools are not passed properly, and the person makes force and worsens the condition, and this condition goes on. So therefore, instead of just giving the purgatives or medicines for passing the stools, we have to treat the underlying condition, that is we have to improve the digestion. That is very important. When digestion is corrected, then constipation will be also treated properly, then the stools will be formed properly, and then they will be evacuated properly. So this is very important to understand. Otherwise, what happens, I'm not making comment on any specific product or any specific company, but कायम चूर्ण तो कायम ही लेना पड़ता है, फिर उस जिंदगी भर लेता रहता है वो आदमी, because digestion is not improved and he is taking just some medicine which will help in passing the stools. Now, when we talk about the pravardhan of purish, that means evacuation of the bowels, then apan vayu, as we know, it is linked with that. And but apan vayu is also linked with other factors like purish, mutra, shukra, artava, garbha, nishkraman. All these factors are linked with apan. Therefore, they are interlinked, and therefore, in conditions related to mutra, like Vatasthila and Mutra Jathar also, the text described Purish Vibandha. Therefore, when Mutra Pravardhan is not proper, that may in turn affect Mala Pravardhan also. Same way, Artha Pravartan may affect Pravardhan of Purish and vice versa. And Garbha Nishkraman. Therefore, Garbhini also get Vibandha sometimes there. And Shukra also. So there are some people who are performing Ati Vyavaya or Ati Astamaitun or something like that. And because of that also Apan Vikruti takes place, and therefore indirectly there is effect on Mala Pravartan. This is also practically observed. And in such patients, we cannot just give medicines which will evacuate the bowels, but we'll have to treat the underlying condition, therefore. So in such conditions, we'll have to treat the patients by giving medicines like Shatavari, Ashtimodhu. And in first chapter of Sutrasthan, it is told that Dugdha is very good for Vibandha of Purish. So that we can make the use of that in this condition. We'll have to take into consideration which factors they produce the Purish ultimately. So the Kittansh from Ahara, then Ghanamala from all over the Dhatus, then part of Udak is also getting converted, it is combining with Purish. Then Pachak, Ansh of Pachak Pitta comes, and therefore in Ruddhapata Kamala, Purish Ranjan does not take place and whitish Tilapishta Nibha stools are formed. And Sneha Ansh from Majja is also coming and joining the Purish, and that's why the Purish is formed. So this is also very important when we treat constipation from Ayurvedic perspective. Which of these factors is not formed properly, which is abnormal? Accordingly, we'll have to treat. For example, if Udakansh is not proper, the person is not taking proper drinking water properly, then that needs to be corrected, or the fluid intake needs to be corrected, and then constipation can be treated. Pachak Pitta, if it is not functioning properly, then that way it should be treated. For that purpose, there are various medicines which will help in that, like Arogyavardhini, Tamra. They are performing Bhedan of Pitta, and then that Pitta will come to the Purish, and because of that Sara Guna Pitta, stools will be properly evacuated. Tamra, Kumari, Katuka, such kind of medicines. Then Phalatrikadi Kwath, or it is available in the market in the name of Vaza Guduchadi Kwath from South Indian pharmacies. That can be used for this purpose, or Patola Katuru Hendadi Kwath, that can be used for this purpose. Now, Majja contributes to Purish by its Sneha Ansh. A Sneha from Majja is coming to Purish. And because that is not coming, sometimes the stools are hard, and that's why they are not passed properly. This is also observed in many patients, usually who are performing Ati Chintan, thinking, like researchers, scientists, computer workers, teachers, etc. In them, this kind of condition we find, or due to some other reasons, Majja Kshay is taking place. Then also we can observe this. And in these patients, when we give them medicines like Jatamausi or Brahmi or Shankhapushpi, then they get very good relief. And usually we are giving the medicine, this Jatamausi we are giving at the night time. So people think that this is the medicine for evacuating the bowels, and therefore they tell that आपने जो वो संडास वाली दवा दी थी वो बहुत अच्छी है. तो हम लोग बोलते हैं अरे जटामाउसी का ऐसा अपमान मत करो, उसको संडास वाली दवा बोल रहे हो तुम. So they think that it is for that. By taking Jatamausi, their stool habits are corrected, because Vata Shaman takes place, Majja works properly, and that's why the Snehansh in the stools is improved, and the control over Gati of Vata is obtained, and that's why even the constipation gets corrected with that. And Brahmi, of course, it is having Saraguna. The Brahmi will be even better if Pitta dominance is there, and we use Brahmi, then it will be a better choice. Shankhapushpi is used in when Vat dominance is there, Dhatukshajanya Vat is there, then it is used. So even under Medyadravya, we have to make a choice. Now, in the patients having constipation, we have to find out what is his diet, and therefore which are the factors which are leading to this constipation. So Hetu, and even while treating, we have to understand the effects of Rasa on that. So you can see that Amlaras performs Anuloman. This is very important, and because it will help in proper evacuation of the stools. Lavan Rasa Stamba Sangata Bandha Vidmapana Karoti and Margan Vishodeti. So therefore, for removing Vibandha, Lavan Rasa is very important. When it is properly used, Vibandha will be removed. Katuras Margan Vishodeti Bandhan Chinati. So at proper use of Katuras, because Katuras excessively used can cause Vibandha. Tiktaras is Purisha Shoshana, so Tiktaras can cause Vibandha as such. And Kashayarasas Tammana Atiyogat Purisham Avagruhnati, Purish Avrod, Malavibandha can be caused by Kashayaras. And there are some certain patients, for example, one patient who was coming to me, he was having Malavibandha, as well as his quantity of urine was also getting reduced day by day. And there were other things, there was dryness of the skin, because sweating was also very less, and he was also having weakness and all. Then when properly inquired, we found that he was taking Karela, that vegetable, daily, because he thought that he will prevent diabetes by taking that. So although he was a thin person and a weak person, but he was taking Atiyog of Tiktaras, and therefore he developed this kind of condition, because Tiktaras performs Shoshan of Purish. Therefore, this needs to be understood, the effects of Rasa, and accordingly we have to treat. Therefore, Ashtang Sangraha has told that Tikta, Katu and Kashayaras, they are Ruksha, and usually they result into Baddha, Vind, Mutra, Maruta, Purish, Mutra and Adhovat. Their Vibandha is caused by Tikta, Katu and Kashayaras. So if the person is using them, that may be a major factor, and that is causing the Malavibandha, and that we need to understand. Whereas Lavan, Amla, Madhura, they are Snigdha and Srushta, Vind, Mutra, Maruta. So that also we have to understand. So by taking Lavan, Amla and Madhur Ras, the evacuation of the stools will be facilitated. So for that purpose, various medicines we can use, or food articles we can use. For example, grapes or draksha or kismis can be used, which is having madhur ras and which will help in proper evacuation in the form of madhur ras. Even when yashti madhu is used in apankal, then that helps in proper evacuation of stools in patients having shukrakshay or majja kshay, and that's where raukshay is produced. Or when already tikta, katu and kashayaras the patient has used in excessive quantity, then also this happens. Therefore, yashti madhu using in apankal is another important thing. And lavan, proper use of lavan, that is saindhav usually we will use, or other types of lavan are also helpful. So we'll have to go in details of the actions of each lavan on the body. For that purpose, to choose which particular lavan, but commonly you can choose saindhav. So when that is used, then malavibandha also can be removed. Now we have to understand that what is the exactly problem. So if the digestion is not proper or the formation of the stools is not proper, then we will have to act through samanvayu, because actions of samanvayu are not proper in that condition. And then we have got a very good advantage in Ayurveda, that aushadh sevan kal. Therefore, if you are using the medicines for constipation at night, then you are just imitating the modern medicine, because their medicines, they are intending that at a particular time the medicine will show its actions. So after taking the medicine, after how many hours the medicine is going to show its actions. That's why it is taken at the bedtime, so that early morning when he wakes up, immediately he will get motions. With that calculation it is given. But if you are giving Ayurvedic medicines, remember that we have got aushadh sevan kal, and they are very important, and it makes huge difference when you give medicine at bedtime and when you give medicine at samankal or apankal. Therefore, if you are using at night time, then now try this way, and you see there will be a lot of change, a lot of good results will be observed. So if the digestion is not proper or the formation of the stools is not proper, then give medicine in samankal, that is in between the meals. So if you will give medicine in that way, that means you can tell the patient that take the medicine in your thali, and after having half of the meals, you take this medicine with a bolus of the food, and then continue your further meals. That will make huge difference in the results. And if the evacuation of the purish, that means pravardhana of purish, that is the abnormality, then apankal, that is before food. So the same medicine which you are giving at night time, divide in 2 doses and give in apankal twice before the meals, and see the difference in the results. Now again, understanding the concept of anuloman, srausan, bhedan and rechan is also very important. Just taking any particular specific combination available in the market and giving is not a wise thing. We have to understand that what is the underlying abnormality, and accordingly whether anuloman we need to give, or srausan we need to give, or bhedan or rechan. And accordingly, if you will give the medicines, then the results will be better. So this also we need to understand, but I'm not going in details of that right now, because that will take a lot of time. Now we will turn to some commonly used medicines. That means commonly means there are a lot of medicines which various Vaidyas are using in their practice. But I am telling you some of the common medicines which I have used in these climatic conditions in Goa. Which medicines I have used, that I am telling. So that's why if now the next lecture, if Patankar sir, he tells some other medicines, don't think that how this is, there is a difference, because he is practicing in a different condition. And of course, what kind of patients Vaidya is getting, and therefore what the Vaidya needs, accordingly he chooses. So now see, Avipattikar Churna, it is a main ingredient is Trivrut, and it is told that Trivrut Sukha Virechananam. That's why that if we want that kind of action, Sukha Virechan, mild action it is having, but in Pitta Pradhan conditions, it is very useful. So if that kind of action we want, we can use it. Just one incident I will tell. One lady, long back when I started my practice newly, that time she came and she told that my son is having habitual constipation, and tomorrow he is having important interview, and you give some medicine by which he will be having proper evacuation of boils and he will be feeling healthy to appear for that interview, and he will be getting selected in the physical tests also. So I told that, okay, take this medicine and give it to him right now. Last night she had come to me. So she said that no, he is coming from Mumbai to Goa, and morning he will reach and immediately he will take the medicine and immediately he has to go for the interview. So now what to do? Because immediately if we want to give the medicine, then it should be that strong that it should act instantaneously. But if it is so much strong and suppose he gets loose motions, then also that lady will blame us. Otherwise, if we will give mild medicine, then also she will blame us that it didn't work. So I thought that avipattikar churna, it is not going to give any trouble. So avipattikar churna in a little larger dose, I gave to him, and he had good motions, and his interview was good. So just an example. Now Gandharva Haritaki, as you know, Haritaki and Erenda Tail, it is Bharjit in Erenda Tail, and this is used in Vata Pradhan conditions mainly, or Vata Kapha Pradhan Avastha. So like that we have to think. Shivakshar Pachan is a very good combination prepared by Vaidyaraj Yadavji Trikamji Acharya. And in that, as you know, Haritaki, Hingvashtaka and Sajjikshar, they are used in combination. So in this Pachan takes place and Anuloman also takes place. And when Sajjikshar is added, Pitta Vruddhi will not take place, or if Utklesha of Pitta, even if it takes place, then with Bhedan action of that Kshar, it will be moved out. So without any trouble, the person will have only the desired actions. So we need not go in minute details of the condition, but in general we can use. So for that purpose, he had prepared this combination. Just Triphala and Saindhav also can be sufficient in many patients. Or in children, just Amalaki and Saindhav are very helpful. That if Amalaki and Saindhav are given just before meals twice in Apankal, then it helps a lot in small children or even in infants when we want to give the medicine. This is a very good choice, because for them this much is sufficient and very effective. And even though it is very tasty also, when we make this combination, you might have tasted already. If not, you can taste, and it is very tasty. So children will also take it very easily, and it will help a lot, because of Saindhav, Stamba Sangata Bandha Vidmapan. So immediately the obstruction to the stools is removed, and with Amalaki Anuloman takes place, and both these medicines, they are having effects like Vrusha, etc. So even the bala will be maintained. Now in tradition of Vaidyaraj Joshi from Pune, Triphala and Katuka, this kind of combination is used. Then the effects of Katuka, we fear that it will cause trouble in the stomach. That is not happening. And Yadavji Trikamji Acharya, he told that by adding Sajjikshar, so instead of Sajjikshar, these days we are using soda bicarb. Natural Sajjikshar is not easily available to us. So when this combination is made, then the Katuka, its actions, gripping pain in the abdomen and loose motions, that kind of action is not happening, but proper evacuation of bowels takes place when this combination is made. Chintsa Lavantail, as you know, is and Triphala, Katuka and Sajjikshar is a drug of choice when the patient is having Amla Pitta or related to Sama Pitta conditions, Pachan and Bhedan of Pitta, like that actions are observed. Chintsa Lavantail was used by Vaidyaraj Datar Shastri, and in very hard stools, and when Snigdha Guna is less, and that's why it is happening, then it is a Snigdha Guna and Anuloman, and in that he used to have groundnut oil, and that's why he told that it is parthiv in nature, and that's why it helps better. Erenda tail is very important, and Erenda is that way having a lot of good actions on the body, like Vrusha. It is described as Yoni Shukra Vishodhan. It is Medha Kanti Balaprada. Like that, actions are there, and it also helps in Rudrok, Prushta Shul, Katigraha, Guhya Shul. So that means Shul, in Shul also it is going to help. So Erenda tail is good choice in many conditions, and it is Snigdha but Amapachan. That's why it is a very good medicine. And soft gel capsules of that are available in the market. You may be knowing one of them, which I am using, I have quoted here. There are other companies also preparing. Ayurved is a type of Srausan, and when we need that, then we can use. And Ayurved in Charak Samhita itself, it is described that Ayurved is for the patients who are very delicate, or they are children or infants, children, then they are suppose uh, aged patients or who are weak patients. For them, Ayurved is very helpful, and Ayurved is Mrudu, Madhur, and Shita. It is, and it is Madhur Rasatmak, so that's why it is Balya also. So it is used in conditions like Jwar, Rudrog, heart. So there we don't want to give something medicine which will be very strong and that may cause trouble to the patient. So there Ayurveda is a choice. In Vata Rakta, without increasing Pitta or without performing Rakta Dushti, it is performing its actions. A lot of other medicines are there, like depending upon the underlying condition, like Phalatrikadi Vasa Guduchadi, already I have mentioned, and Arogya Vardhini, because it is containing Katuka and other medicines. It is very good medicine which performs Pachan, and it not only performs Pachan at Jatragni level, but it performs Pachan at the level of various Dhatwagnis ranging from Rasa to Med. And that's why it is very important. And on, if you want to learn details on Arogya Vardhini, Vaidyaraj Khadiwale, he had written a book on that, Arogya Vardhini Tantra and Mantra, a special book he wrote on the effects of Arogya Vardhini and how to use it. And of course, most of the Vaidyas, they are already using it. If we want to use, we want Snigdha Guna, then Triphala Kruta is very important. Then Arishta Kalpana, Abhayarishta is there, and Bhrungarajasa is very important because it is mentioned in the Rajekshma Chikitsa Adhikara actually. Therefore, it is not just helping evacuation of boils, but by improving proper evacuation of mala, by improving proper absorption of saransh, it is helpful in Rajekshma also, though it is giving bala to dhatus. So that's why it is important. Now, in many patients, krimi are associated with malavibandha. It may be vice versa, that either krimi are there and that's why the patient is having vibandha, or the patient was having vibandha and that's why mala are getting accumulated in the body for a longer time, and that's why krimi are produced. It may be anyway, but in majority of the patients, specifically when the patients they get malaveg after foods, then that may be indicative of grahani dorbalya also, but it may be very important symptom of krimi also. Immediately after having food, the patient starts getting bloating of abdomen, gases, and again in gulma, like that it is mentioned in krimi also, that way it can be observed that the person feels that as if he has to pass the stools, but he's not able to evacuate the bowels properly and when he goes for defecation. So in such conditions, all these conditions, and he's having crave for certain things like jaggery, good or oily things, especially it is very typical things are observed that the patients tell that only in the evening I get the strong desire to eat outside food which is oily or like that, and otherwise I can't stay at home. I'm getting irritated if I'm not getting that food. Likewise, there is a list of various observations from which we can understand that the patient, yes, he is definitely having krimi. And if it is there, then krimi kuthar or krimi mudgar like medicines, they can be used. And they are very effective if they are of good quality. They are very effective when the modern, we are getting many patients who have taken modern medicines for worms, but they have not worked, and immediately when we give Krumikutar, it works. It is such a good medicine, but it should be of good quality. So even that is given, then immediately effects are observed and immediately the problems related to that are solved. The difference, I'm not going into details of the difference when to use Krumikutar and when to use Krumi Mudgar, because it will take again a lot of time. Usually it is given with the combination of Kampillak because it is Tikshna Rechan, and the Krumis are having the tendency to stick inside. They will not be ready to easily die. They try to stick inside, they try to move to some other track in the body. Therefore, Kampillak, it is having such strong action that it will not allow the Krumi to stick inside. It will forcefully take them downwards and move them out. So that's why Krumikutar usually in combination of Kampillak it is used. So some important medicines I told you which can be commonly used, and Again, Panchakarma, various Panchakarma are very important. I have just mentioned 3 of them here because we have got a short span of time to explain this. That's why only 3 examples I have given. Basti, everyone knows about that. Varti is very important for instant results. When the patient is having constipation and is having a lot of trouble and he has not passed motion, suppose for 2-3 days or more days. We get a variety of patients of constipation, as you all know. I got one patient, he will not get the sensation of stools, and after 1 month, he will get admitted in the hospital, and the doctors will pull out that stools outside, and then only his bowels will be evacuated only once in a month. There were many patients. I got some patients who told that only once in a week they pass the stools, and when I gave medicine for some other problem, and I told them that by taking this medicine, your bowel habits will be also regular and they will daily get stools. Then they said, no, please, I will stop the medicines. Don't give the medicines. Only once in a week is okay. Who will spend so much time daily? Like
Dr.
that also
Dixit,
patients are there.
Dr. Dixit,
So yeah.
Sorry for interrupting you. We have few minutes left.
I'm concluding. Yeah.
Thank you.
So Varti is therefore very important in such patients. When we use Varti, then instantaneously the bowels are evacuated. And Nabhi Purana is another important method used, especially in the parampara of Vaidyaraj Nanal. And in that, what we are using is Hingu Triguna Tel, mainly we are using, which is available in the market. Sometimes we add Amalaki Tel to it, and that is added in the umbilicus of the patient, and around the umbilicus little massages are done. Then with that, it helps in passing stools or passing gases, and the patient gets good relief. So this is also one method which can be very easily used. So I think in the year 2020, we have to do the things in a very short time. So we have in a very short time taken a review of the highlights of Chikitsa of Malavshtambh from Ayurvedic perspective. So I thank the organizers for giving me an opportunity to express my views on this topic. And thank you all the listeners very much for their cooperation. And thank you very much.
Thank you, Dixit sir.